A mom from Katy sure is looking forward to Mother's Day this weekend. She had to undergo emergency surgery during her pregnancy a few months ago and didn't know if she or her baby would survive.
But her medical team at UTHealth Memorial Hermann put serious plans in place to make sure they both did.
Juno Evans cherishes every moment with her baby Jackson.
My entire world. I'd be lost without him.
Juno didn't know if she would ever even get to meet her precious little one.
I wrote letters before we left the house to both of them. It was hard.
That's really hard.
Yeah.
What'd you say?
I love them. I'm sorry I'm not here. Just take care of each other.
But you're here.
Yeah, I'm here, so those letters are tossed away.
Juno was born with several serious heart problems that resurfaced when she got pregnant.
When I was about 2 months old, my mom was giving me a bath and I turned blue. So they had to rush me to the hospital, and that's when we found out what was going on. After that, they found out that I had the aortic valve stenosis, the aortic coarctation, and a bicuspid aortic valve. So none of that is good.
Juno underwent multiple surgeries during her childhood, and everything seemed fine, so she stopped her checkups at 18. Fast forward almost a decade.
And then I got pregnant last year. So I was like, well, let's go make sure everything's okay with my heart, and just to be safe.
Unfortunately, doctors informed her that her heart was far from okay. She was 5 months pregnant and needed open heart surgery. That was risky for mom and baby. So vascular surgeon Dr. Rana Afifi with UTHealth Memorial Hermann helped put together an entire team to make potentially life-saving decisions for both of them. She developed an actual program to help moms with complicated pregnancies.
And it's never a one person's job. It's a multidisciplinary approach, meaning that it's multiple specialties in medicine, but also multiple roles. So it's also physicians and genetic counselors and nurses, and at some point it's also social workers.
The team decided to temporarily repair Juno's faulty heart valve. Then after her baby was born, they would replace the valve. The stats for the procedures were scary.
Either one had a 50% chance of losing my son. So that was extremely hard for both of us, me and my husband.
All Juno could think about was her unborn baby. Her nurse recorded his heartbeat before her surgery, and now she gets to see it every day in this special painting in Jackson's room. Doctors were forced to take him a few months prematurely at 32 weeks to help protect his mother's heart.
We also had to be prepared as a heart surgery team to go on the heart-lung machine if her heart did start to fail during the delivery of her child. But fortunately for her, that all went very well, very smooth.
Juno recovered in the hospital for a few days after her C-section. Then it was time for open heart surgery.
It was nerve-wracking, thinking that might be the last time I get to hold my son, talk to him, tell him I love him. So the night before, we had gone down to NICU, and I just told him, I love you. Be good for your daddy if I'm not here.
But she's here. All went well.
It's a very high likelihood she'll be fine for many, many years to come, and can live, in my opinion, a pretty much normal life.
Yeah, it's me.
Her loving husband couldn't be more thankful.
She's here. Just means a lot. And being able to celebrate Jax and her, is just phenomenal. Because, could have been that it wasn't, Sometimes you just have to put faith in the right people, and the doctors did their job.
Now Juno can enjoy her lifelong dream and new job of being a mom.
That precious mom has been through so much, but I love their happy ending and her new beginning as a mom. I'm going to continue that conversation, talking more about how faith got her through this really tough time. So join me during my live stream, Lunch for the Soul. That's 12:30 today online. You can go to Fox 26 Houston's Facebook page, Twitter, YouTube, or just go online to our website. We've got it all there.
Talk about uplifting at the lunch hour, right?
Yes, especially before Mother's Day.
Yes, that will get you through the rest of the day, whatever you're facing. Thanks, Melissa.